Hello and welcome. You're watching Global Insight with me, Oh Soo-young. From Arirang News Centre in Seoul, we speak with experts from around the world to hear their views on issues making headlines. The world has seen a fourth straight week of decline in COVID-19 cases in the first week of February and a lower number of deaths as countries implement public health measures more stringently than ever before, as well as wide-scale vaccinations. But the World Health Organization has warned that it's not the time to relax measures or let down our guard, as the virus continues to circulate widely and new variants are emerging. We discuss some of the biggest concerns today as countries everywhere try to prevent further waves of the virus and rush to secure the effectiveness of vaccines, medicines and tests for COVID-19. For this, we connect with Dr. Bharat Pankania, Senior Clinical Lecturer at the University of Exeter Medical School with more than 20 years of advising health authorities in communicable disease control and infectious disease management. It's lovely to have you back with us. And we also connect with Dr. David Kwak, Professor of Family Medicine and physician at the Hyang University Hospital in Seoul. Thanks for joining us as well, Dr. Kwak. Now, to go straight into the discussion, let's start with you, Dr. Pankania. Now, we've been hearing a lot about these new variants recently, and while South Africa halted its vaccination program amid the spread of these new variants of COVID-19 and the news that the AstraZeneca vaccine might not be as effective, we heard that scientists are now working on a second generation of vaccines. Does this mean that every time the vaccine evolves or the virus evolves or changes, that we're going to have to keep updating the vaccine? And also, what does this mean for the people who already got the first generation vaccine? Will they have to get another jab?
Yeah, thank you. So it is very important to note and feel reassured that even if you've had the first generation AstraZeneca Oxford vaccine, it protects against severe disease. And that is clearly demonstrated by research studies. What it shows is with the variants, for example, the South African variant, we may get that the person, whilst protected from severe disease, may get a mild to moderate infection. And what that means is you can get infected, it may be mild, it may be moderate, you may infect other people, but at least you are protected from severe disease. So that's a very good thing. Therefore, to take that argument forward, I feel it was unfortunate that the South African government decided to halt the use of the AstraZeneca Oxford vaccine momentarily, because we are here in the game of preventing serious illness and death. And therefore, they should have continued with the vaccine, which I hope they will do. And finally, the third part of your question is, will we need to change the vaccines as we go along as the new variants of the SARS-CoV-2 virus emerge? And my answer is yes. So what we will have to do is mirror the structural protein, the spike protein of the SARS-CoV-2 virus, to mirror that in the instructions in the mRNA that is used to make the structural spike protein when inducing immunity. So it's not all lost, it's not all bad news.
Well, Dr. Kwak, what would this mean for South Korea's vaccination plan, which is set to begin in the coming weeks? Should South Korea still get the first generation vaccines from AstraZeneca?
Well, I agree with what's been said. The government, because they have firmly planned ahead of for the nation to receive the vaccination, I think they should go ahead with their original plan and try to inoculate as many people as possible, because at this current state, it's more beneficial to actually receive these all kinds of vaccinations that we have at hand than not. So we should go ahead. I think personally, we should go ahead with the current plan of vaccinations, but also as what was mentioned, when we could also at the same time seek the alternatives to AstraZeneca's. Meaning, I'm not saying that we should just change out completely the plans for AstraZeneca, but we should urge them to make the modifications so that they could fight better against the new variants that are obviously we will be facing sometime in the near future. But in regards to the current situation, well, what we have hands in regards to the tools we have to fight against these viruses is really only Pfizer's and AstraZeneca, and they are going to help us in the fight because it will minimize the progress from having mild symptoms go on to more severe symptoms. And also, it'll mitigate the virus spread because some of the people will actually get enough antibodies to completely fight off the virus when it actually comes into the body. So I think we should go ahead with the originally planned for the vaccinations, but also at the same time seek what we can do about getting additional or alternative choices of vaccines.
I see. And Dr. Pankania, now, while France plans to give people who already had COVID-19 single doses of the vaccine, does that mean that once you've had the virus, you're immune to all the different variants of the disease, or can you get ill from a more evolved strain?
That's a lovely question. And the answer is we don't know. What we expect and what we think empirically from first principles is that there will be cross immunity. In other words, if you got infected by the original circulating SARS-CoV-2 virus, and then there is a new variant in circulation, we expect that your natural immunity will provide cross immunity for the original strain as well as the variant. And therefore, again, it is an issue of reassuring and advising our viewers and listeners that it is not all bad news. Then the second step is you immunize even the people who've had the infection. And by immunizing them, what you're doing is boosting their immune system. So you're giving them an extra stimulus to recognize and remember and keep on remembering these SARS-CoV-2 viruses.
And Dr. Pankania, now the UK Health Secretary, Matt Hancock, he said that he hopes new drugs by the year end would make COVID-19 a treatable disease that we live with like we do with the flu. This, however, many have pointed out that it suggests that the UK isn't going to try and eliminate the disease altogether. And scientists have been warning against simply treating COVID like the flu, given the mutations that we're seeing. I want to know what you think about this.
So I think we have to aim for a zero COVID policy. And when you have a zero COVID policy locally, nationally, and internationally, the world is in a better place. If you don't aim for a zero COVID policy internationally, then you will keep on receiving variants, and the variants may overcome the existing immunity that you have. So our first point of attack should be we aim for zero COVID, and then we also do our research. And if we were lucky enough to find medication that works against circulating strains of SARS-CoV-2, then we feel we are in a better position. At the moment, we don't have the drugs which we can give to you, which purposefully, extensively treat and suppress and eliminate a SARS-CoV-2 infection. We know that they help, but we don't know of any drug that works wonderfully 100% of the times.
And Dr. Kwak, I'd like to hear your opinion on this as well, whether countries should aim to live with the virus or go for a zero COVID policy, as Dr. Pankania just said. What do you think would be what we would call a manageable level of COVID-19?
Well, I actually agree with Dr. Pankania 100%. The governmental or the general population's aim against the virus should be zero virus tolerance. We should aim to completely eradicate the virus off of this planet, period. But in reality, as what was mentioned, in reality, we currently don't have the tools that is known to purposely work 100%. So I think it's more of a reality issue that the UK government went out and said it will be managed in the future. But our aim is still to completely eradicate and have this virus erased off of the planet. I think that still remains also with the UK government. as it would be with any other governments around the world. Just realistically speaking, we're hoping that it will be gone as much as possible by the set of time that we have set up in the near future. But in reality, I think it will become more manageable within the year. And then when the time passes on, it'll be gradually more or so eradicated off of the population.
And Dr. Kwak, after the long Lunar New Year holiday, South Korea is easing regulations on outdoor activities and social gatherings from Monday. And while the Seoul capital area will lower the level from 2.5 to 2, I believe, and the other areas in the country will be at level 1.5. But then many are a bit concerned, though, because we are still seeing around 300 to 500 infection cases a day, and many wonder if this really is the right time. As we move forward with the easing of restrictions, what would be your policy recommendation to the authorities?
I would actually recommend keeping the 2.5 level for 2 or more weeks because we're coming off of the holidays. It means whether the government or we as citizens have planned for it or not, some people would have met and shared some great time with families and friends in the vicinity. It means that there were clearly more chances for the virus to spread among our population. And when we go into the days after the holidays, it means those people are going back to the society to create more chances for the virus to actually spread to other parts of the society, other sectors of the society. So I think the 2 weeks or 3 weeks following the holiday weekend is more of a critical time that we need to keep measures much higher and have people more controlled. So I am quite personally concerned that the easing of the measurements will create chances for the virus to start spreading again. We're already seeing a couple different cluster infections happening, not just through smaller sectors of the society, but through like hospitals and social gatherings. So we should definitely be very careful in the coming weeks.
And Dr. Pankanya, before we go now, most developing countries, they rely on the AstraZeneca vaccine quite largely. And this, of course, is seeing a rather slower approval process than others. And while in the COVAX alliance, Pfizer only pitched in about 2% of its supply, and Moderna still has yet to finalise an agreement with the global alliance. Is it right that these pharmaceutical companies should charge as much as they do and make the vaccine recipe so exclusive, considering that this really is a global pandemic and many of them were funded by public money? What kind of measures do you think need to be prioritised to help countries vaccinate their people as quickly as possible?
So my understanding is that AstraZeneca Oxford are going to supply the vaccine at cost to all the nations, especially the poorer nations. So that is well done to them for thinking of mankind and supplying it. My bigger concern is, are you able to supply as many vaccines as are needed as fast as possible? And on that point, I suggest that international governments with the technology, with the know-how, enable the setting up of plants so that additional manufacturing capacity is generated under license, under royalties, and we enable the manufacture and supply of additional vaccines which are inevitably needed, and they will be needed for many years to come.
Well, I'm afraid we're going to have to wrap up the interview here as we're out of time. But that was Dr. Bharat Pankanya, Senior Clinical Lecturer at the University of Exeter Medical School, and Dr. David Kwak, Professor of Family Medicine at the Hyang University Hospital in Seoul. Thank you both so much for your time.
Thank you.